My name is Amanda Logue. I'm the Chief Medical Officer for Lafayette General Health.
My name is Henry Kaufman. I'm the Chief Medical Officer at Our Lady Lourdes Regional Medical Center.
As the Chief Medical Officers of our hospitals in the area, we definitely share a lot of information regarding our situations with COVID at this time and in the past. So we wanted to give an update as to where we're at with our hospitals. At Lafayette General, we've been seeing a lot of community spread, and with all the community testing that's been done in the area, we're seeing that average age is around 18 to 29 years old. However, we're also seeing quite a resurgence of hospitalizations in the hospital itself and patients that need critical care beds. We've seen at Lafayette General about a 200% increase in hospitalizations over the last 3 weeks, which really correlated with the timing of phase 2. And those patients tend to be still in the older category. We're seeing our average age of patients in the inpatient ward is about 54, and in the ICU is closer to 65. What I'm learning from that is that there's a lot of community spread among the young population. However, they're transmitting the virus as well to the older population who's needing hospital stays. We certainly encourage testing when necessary, but we also really are concerned about the amount of increase that we're seeing in this period of time. I do know that Lafayette General and Our Lady of Lourdes Regional Medical Center together are in the top 5 hospitals in the state with the number of COVID positive patients within the hospital. That's very concerning considering where we were before, and we're seeing a lot bigger jump in numbers than we had anticipated at this time. We're also the lowest in the state in terms of our region of available ICU beds. So we're using a lot more ICU beds this time around as well. So that's certainly a concern for me at my hospital and our intensivists who have to take care of these patients. And the number of ventilated patients is pretty high as well too. I'm interested to hear what you guys are seeing at Our Lady of Lourdes.
Yeah, absolutely. We're seeing a similar resurgence. It started about 3 weeks ago, and like you said, commensurate with the phase 2 reopening. Average age of the hospitalized patient is still running in the late 60s, early 70s. A little bit different from the previous spike in pandemic cases is that our case mix seems to be a little bit different in that we don't have quite as many patients in the ICU this time. There is a bit of a lag from, as you know, the onset of illness to when the patient ultimately needs ICU care. But even in the past couple of weeks, we haven't quite seen that. So it's a much larger number of floor beds being used at our facility as opposed to ICU. That being said, we're still seeing some people get critically ill from this and succumbing to the disease, unfortunately. When we do a little bit of just anecdotal research on, when these patients come in and, how they're getting it, usually there's some association with some younger member of their family who's been out and about and exposed and then brought it back into the home, where, when you're living as a family unit, it's much harder to practice social distancing. And so because of that, there needs to really be an enhanced awareness of community spread amongst those 18 to 26-year-old population, especially that are going out in the community, being active, and then bringing it back home where it's affecting the older generations and having a significant impact there. Lourdes, unfortunately, is at its peak today in regards to the number of cases, so we have surpassed where we were at the peak of the pandemic back in April. Fortunately, we've not seen that peak reflected in ICU, but we're waiting with bated breath for the potential for that to happen and making appropriate preparations. So we are seeing a resurgence in cases right now, and there's been a significant increase, especially in the last few weeks. That being said, we're in a much different position now than we were a couple of months ago when this was all just beginning. We didn't have as much information. We didn't understand how to take care of this disease as well. I think we're all much more prepared this time. I think we have a better understanding of the resources that are going to need to be used, the PPEs, the personnel, the surge capacity for both regular units and the ICU. I think the other thing that we've really learned is that the hospital still is a very, very safe place to be. By practicing good hygiene, hand washing, masking, social distancing, good use of personal protective gear in the hospital, we've had very low to no transmission of COVID amongst patients in the hospital itself. And so it's very, very important that people continue to come into the hospitals and get their care.
I couldn't agree with you more. We have the same scenario at Lafayette General. Our PPE supply is in good order, and we continue to take advantage of every opportunity for ordering that we can, and we have good deliveries coming in, so we feel really good about that. We also don't want to see people delay getting care that they desperately need, where they might have been afraid when we were going through this a first time around. We have definitely learned from our experiences, and we have avenues that patients can come in a safe mechanism. We've also adapted our treatment protocols based on the new information that comes out by research that gives us some better guidelines on how to treat patients, even though a lot of it is still not known at this time. I would encourage that patients come to the hospital to seek care if they feel like they need it, and we certainly don't want them sitting at home suffering.
Yes, we're definitely in a much better place than we were at the beginning of this pandemic. I think both as a community, as both of our healthcare systems individually, and as well as the hospitals in general.
So we get the question a lot about people who are now being exposed in the community, and I know you guys are getting the same questions too. They're at a party or they have been out with their family and they suddenly find out that somebody has come back positive, and the question is what to do at that point. Testing is certainly an option that we'll discuss, but really quarantining at home, which really means staying away from unnecessary exposure to other people, is the only way to really ensure that you're not going to transmit the virus to somebody else. Typically, after you've been exposed, if you've had a significant enough of an exposure to somebody who was ill and carrying the virus, you're going to see symptoms in about 7 to 10 days, maybe a little bit longer, which is where that 14-day window came from. If you have to leave the house and be out around people, I cannot suggest that you wear a mask any more strongly, because you never know when you might be positive to that virus and be carrying it and not know it yet. Many times we're positive for the virus, we have it and we don't even know it yet, and we haven't had any symptoms, and so therefore we have to protect the people around us from catching it when we don't even know. So we really want people that are leaving the house in those quarantine days, if they have to be properly protected and to distance themselves from others. That really gives you the opportunity to make sure that you don't come down with the illness, and if you do, that's the time to certainly get tested and seek medical care.
Absolutely. And a lot of these people who have been exposed out in the community, as people are getting tested and being proven to have COVID, they're then wondering what they should do. If there's been a significant exposure, and the CDC currently is defining a significant exposure as being within 6 feet of a person who has COVID for 15 minutes or more. Not that you can't get COVID with a lesser exposure, but that's certainly a significant exposure. There's a lot of questions about should we be tested, and the problem with testing individuals who are asymptomatic is that the false negative rate is very high. That means that you can't rely upon a negative test to feel that you're safe and you don't need to quarantine. So we're not currently recommending any individuals who are asymptomatic be tested, just because the tendency is to think that they're safe and to not protect themselves and to not quarantine, and they could very well be infected and shedding virus and exposing others. So there's currently no role for testing asymptomatic individuals. Certainly individuals who develop flu-like symptoms, upper respiratory infection type symptoms, now diarrhea, cough, loss of smell, did I get them all? Mm-hmm. Those individuals would be very appropriate for testing, but there currently is no role for testing of asymptomatic individuals. So 95 to 96% of cases currently are coming from community spread. That means that they're not coming from nursing homes, prisons, or other institutions, but rather it's people out and about in the community acquiring it from others who are out and about. That speaks directly to the need for social distancing when you can't be, that speaks directly to the need for social distancing. And where social distancing isn't possible, definitely wearing a mask when out in public. There is a growing body of evidence that masking has a real benefit. And so we strongly encourage masking in the community, good personal hygiene, hand washing, using hand sanitizer, minimizing touching your face and your mouth, which is probably good practice anyway, and to just be aware of where you are and how far you're away from people, and keeping your mask on and doing what's right.
I think all of us would agree that we are ready to get back to some sense of normalcy. I think that from the healthcare facility side, we can see the repercussions of what happens when people don't do those things: social distance, physically distance, wash your hands, protect yourself with a mask and everybody else around you. I'm very anxious, I know we all are, to get back to getting our kids back into school, going to see a football game. I just don't see how we're going to get there with our current trajectory if we don't slow things down. And all it takes is for us to manage this wave a little bit better, is to do the things that we've discussed here, and to wear a face covering that will protect you and protect the people around you in case you are carrying a virus. I think that is our ultimate need, and we want to be here for the community with as many available beds as we can to take care of anybody who needs it. But with the direction that we're on right now, we've got to change our behaviors, and we have to change them quickly in order to not only slow down the disease in the hospitals and the health systems and the pressure that's putting on our doctors and our nurses and everybody that's at the bedside, but certainly so that we can even consider moving into phase 3 and reopening businesses that aren't afraid that they're going to see another resurgence of cases within their own business, and that their employees and the patrons are safe.
Absolutely. If we don't want to overwhelm our local healthcare facilities, if we want to enjoy the patronage of our local businesses in an unrestricted fashion, then we as a community have just got to be smarter and more diligent in the social distancing and wearing our masks and practicing good hygiene, especially right now amongst our younger population.